Hi friends, good evening. Once again welcome back to my channel Mugambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. Also these questions will helpful for your other nursing officer exam preparation. We are discussing important questions and answers. Today's first question. Most common cause of blindness in India is options. Option A cataract, option B refractive index, option C glaucoma, option D vitamin A deficiency. Most common cause of blindness in India is, correct answer is option A cataract. Move on to the next question. Typical appearance of diabetic cataract is options. Option A sunflower type, option B polychromatic luster, option C breadcrumb type, option C snowflake appearance. Question. What type of appearance we can see in case of diabetic cataract? It will be like a snowflake appearance. Option D is the correct answer. Snowflake appearance means like cloudy appearance we can see in case of diabetic cataract. Move on to the next question. Diabetic cataract occurs due to accumulation of options. Option A fructose, option B galactitol, option C glucose, option D sorbitol. In the previous question, we saw the appearance of diabetic cataract. But here the question is, diabetic cataract occurs due to the accumulation of which substance? And the correct answer is, it is due to sorbitol. Option D is the correct answer, accumulation of sorbitol. Move on to the next question. Thanatology is the study of options. Option A injuries and assault, option B death related to thermal injury, option C death of all aspects, option D life after death. Thanatology means it is the study of death of all aspects. Option C is the correct answer. Thanatology is the scientific study of death and the loss brought about as a result. So thanatology is the scientific study of death and the loss. Move on to the next question. The vitamins, those are necessary for neurological functions. Options. Option A thiamine, riboflavin and cyanocobalamin. Option B thiamine, riboflavin and pyridoxine. Option C thiamine, pyridoxine, cyanocobalamin. And option D thiamine, folic acid and cyanocobalamin. Our question is, which among the following vitamins are necessary for the proper neurological function? And the correct answer is, it is thiamine, pyridoxine and cyanocobalamin. Option C is the correct answer. Thiamine is vitamin B1. Vitamin B1 deficiency cause beriberi, and also it can cause or it can affect nerve system like peripheral neuropathy, ataxia. It is mainly seen in case of dry beriberi. Dry beriberi is a type of neurotic beriberi. And the next vitamin is pyridoxine. Pyridoxine is also known as vitamin B6. It can also cause some neurological manifestation. And cyanocobalamin. Cyanocobalamin is vitamin B12. This vitamin is essential for the degeneration of nerve fibers of the spinal cord. So here vitamin, those who are necessary for neurological functions are thiamine, pyridoxine and cyanocobalamin. Option C is the correct answer. Move on to the next question. What is the optimum temperature to store blood after collecting it? Options. Option A 15 degrees Celsius, option B 20 degrees Celsius, option C 22 degrees Celsius, option D 25 degrees Celsius. Our question is, what is the optimum temperature to store the blood after it is collected? Okay, and the correct answer is, it is about 22 degrees Celsius. Option C is the correct answer. Blood is stored at 22 degrees Celsius because at this temperature, the blood proteins are safe from degeneration, the cell function properly, and the presence of anticoagulant ensures that the blood is not clotting. So at this 22 degrees Celsius, the blood proteins are safe and also cells are function properly, and the anticoagulants ensure that the blood is not clotting. So blood is stored at 22 degrees Celsius. Move on to the next question. A nurse is performing an assessment of a pregnant client who is at 28th week of gestation. The nurse measures the fundal height in centimeters and expect the finding to be which of the following? Our options: option A 22 centimeter, option B 30 centimeter, option C 36 centimeter, option D 40 centimeter. Here our question is, a nurse is doing assessment of a pregnant client who is at 28th week of gestation. So that gestational week is 28th. And she is measuring the fundal height in centimeter. So according to gestational weeks, what is the fundal height? That is our question. During the second and third trimester, the fundal height in centimeters approximately equals to fetal age in weeks plus or minus 2 centimeter. Here the fetal age is 28th week of gestation. So we can add 2 or minus 2. We can add 2 means we will get 30 centimeter. If we are minusing means we will get 26 centimeter. So 26 is not here, 30 is there. So 30 is the correct answer, option B. Normally, at 16 weeks, the fundus can be located halfway between the symphysis pubis and the umbilicus. At about 20 to 22 weeks, the fundus is at the level of umbilicus. And at 36 weeks, the fundus is at the level of xiphoid process. Move on to the next question. A nurse is caring for a client with chronic occlusive arterial disease. What precipitating cause is the nurse most likely to identify for the development of ulceration and gangrenous lesion? Our options: option A emotional stress, which is short-lived. Option B poor hygiene and limited protein intake. Option C stimulants such as coffee, tea or cola drinks. Option D drama from mechanical, chemical or thermal sources. Here the question is, a nurse is caring for a client with chronic occlusive arterial disease. So occlusion or obstruction in the artery which may lead to decreased blood supply to the area. So here the question is, what is the precipitating cause does the nurse identify for the development of ulceration gangrenous lesion? Once the patient may develop or chance to develop ulceration gangrenous lesions, what is the precipitating factor? That is the question. So here the answer will come. For the development of ulceration gangrenous lesion, there may be trauma from mechanical, chemical or thermal sources. Option D will come the correct answer. First option, emotional stress, which is short-lived. It will not be a proper precipitating cause for the ulceration gangrene, and poor hygiene, limited protein intake and stimulants such as coffee, tea or cola. This all not immediately developing ulceration gangrene, but any injury like mechanical, chemical or thermal sources which can lead to ulceration gangrenous lesion. Next question, which disease is also known as developmental coordination disorder? Options: option A dyspraxia, option B dysphasia, option C dyslalia, option D dyscalculia. Our question, among the following, which one is known as developmental coordination disorder, DCD? And the correct answer is option A dyspraxia. Dyspraxia is a common disorder that affects movement and coordination. And option C, dyslalia, is an inability to articulate comprehensible speech, that is known as dyslalia. Dyscalculia is a learning disability. And option B, dysphasia, is a language disorder marked by deficiency in speech. Move on to the next question. Failure to pass meconium within first 24 hours after birth may indicate which of the following disease? Options: option A abdominal wall defect, option B celiac disease, option C Haspin disease, option D intussusception. Here the question is, failure to pass meconium within the first 24 hours after the birth. If the baby is not passed meconium or first motion within first 24 hours means it may be a chance of Haspin disease. Option C is the correct answer over here. This Haspin disease is also known as congenital aganglionic megacolon. Is a developmental disorder of the enteric nerve system. So it is affecting the intestine, characterized by absence of ganglion cells in the distal colon, resulting in functional obstruction. So because of the The baby is unable to pass the motion, that is known as Haspin disease. The clinical features we can say childhood constipation includes failure to pass meconium in the first 48 hours of life and also failure to thrive, poor feeding, gross abdominal distension and dependence on enema without significant encompasses. So here these are all the clinical features of Haspin disease. So here our correct answer is option C, Haspin disease. We are continuing important MCQ for RRB nursing officer exam preparation. If it is useful for your studies, please share my videos to your friend circle.